Gurmagath, Cian Corla, and there will be printed speeches ready shortly. They're on their way over. Cian Corla, it's hard to believe that it's 607 days since the first case of COVID-19 was detected in Ireland. Little did we know what was ahead of us, a pandemic that upended our lives and changed the way we lived, worked and socialised. This disease has shattered lives. It has taken well over 5,000 of our loved ones from us. It has caused huge fear, frustration and disruption. In healthcare, it has taken a very deep toll. Our healthcare workers have made huge sacrifices. Many are tired and depleted. Many have become sick themselves or have provided care to their colleagues. Many more people are waiting for non-COVID healthcare. At the same time, our healthcare workers have been incredible. There has been record investment and funding for new developments, and our healthcare workers have turned this into record new bed and staff numbers during the pandemic. The vaccine rollout has been a success. More than 7.4 million doses have now been administered since the programme began in December last year. Around 90% of the eligible population are now fully vaccinated. Ireland has among the highest vaccination rates in Europe. Our vaccination rollout has proven what our health service can do when we all work together. There is greater confidence in what our health service can achieve. As I travelled around the country visiting testing centres and vaccine centres in recent months, the pride that healthcare workers have in our health service has been clear and palpable. And I believe we can build on this positivity as we face into winter and as we face into the task of tackling these waiting lists. The pandemic has also shone a light on issues that have blighted our health services for far too long, including a dearth of critical care or ICU bed capacity and a poorly resourced public health infrastructure. Before COVID arrived here, we had just 255 critical care beds. We invested €55 million in that this year, and we'll have 321 permanently funded beds by the end of this year or very early next year. It represents an increase of about 25%, and we're going to add more beds next year, resulting in a 33% increase in permanent capacity since between the start of the pandemic and the end of next year. Are more ICU beds needed than this? Absolutely they are. And I've brought a plan to Cabinet outlining further plans to increase capacity significantly further again. Our public health teams were significantly under-resourced when this pandemic hit. Public health doctors were not given the recognition they deserved and were the only medical specialists who could not progress to consultant status. This impacted our ability to recruit and retain candidates, and it's a dispute that was going on for decades. The government resolved this by reaching an agreement with the Irish Medical Organisation, and I was delighted to see adverts appearing for those consultant posts in recent weeks. Last year I committed to a significant investment in public health when I announced plans to double the workforce by recruiting an additional 255 permanent staff at an annual cost of over €17 million. In a highly competitive employment market created by the pandemic, I'm very pleased to share that the HSE has to date filled 196 of these roles, increasing staffing levels in our public health system from 254 to 450, something I know everyone here will welcome. Like many countries, we've deployed a wide range of measures to battle COVID-19 in the past 18 months. Masks, social distancing, local restrictions, travel restrictions, testing, contact tracing, guidance on improved ventilation and many more. And we're still deploying measures like mask wearing, but lockdowns including the cessation of non-urgent healthcare, sometimes unfortunately, these are not long-term sustainable solutions. Fortunately, safe and effective vaccines were developed in record time. And these vaccines are key to turning COVID-19 into an endemic rather than a pandemic and a controlled communicable disease. Only one human disease, smallpox, has been completely eradicated. Others, such as the flu, as well as measles, cholera, they slowly became endemic. And since the vaccines are remarkably effective in preventing serious disease and death, they can serve as our conduit for control. Many experts believe that the harm from endemic COVID may ultimately fall somewhere between that of the flu and other coronaviruses that cause the common cold. But as we all know, the world is not even close to that point yet. So what's to be done? I want to reiterate, Ceann Comhairle, the case for everyone to be vaccinated. We are a highly vaccinated country, and yet we are seeing that COVID can still create huge pressure on our health service. We've 448 people in hospital with COVID and 88 COVID patients in intensive care. And of course, the 448 people in hospital with COVID, every one of those beds has a knock-on effect on a lot of other capacity in our hospital system as well. Now, we are increasing our efforts, as you would expect, to promote vaccination of those yet inoculated. We've about 360,000 adults who are eligible, but to date have not chosen to get vaccinated. We're looking at what additional measures can be taken to increase uptake with this group, including pop-up vaccination centres and clinics which will begin in early November in local election areas where the uptake is still low. Ongoing engagement is also taking place with industry and civil society organisations to improve uptake among vulnerable workers and migrant communities. I'm appealing here today to those who have not yet been vaccinated to please step up and get vaccinated. I'm asking them to do this for themselves and for everybody else. Our waiting lists for planned care, everything from hip operations to scoliosis procedures, are far too long. I am determined to tackle them and to bring the same rigour to doing so as we have brought to the vaccine rollout. But we need everyone to play their part. So to those who are as yet unvaccinated, your decision to not get vaccinated is helping this virus continue to spread. The most recent figures I have are that more than half of those with COVID in intensive care are unvaccinated. This means ICU beds that are not available to sick patients waiting on urgent surgery, which means we're having to cancel operations for children, for adults in need of urgent hospital treatment and procedures. I met with Nursing Homes Ireland this morning, as I'm increasingly concerned about the rising number of outbreaks in nursing homes. So are those living, working and running our nursing homes. So to those who are unvaccinated, please think again. Get the facts, follow the science, protect yourself, protect those closest to you, and protect everyone else in the country who has fought so hard for the gains that we have made against this virus. As we've seen throughout the course of the pandemic, COVID-19 continues to be a volatile and unpredictable opponent. The disease incidence in the country is high and has deteriorated significantly in recent weeks. Taking into account this situation, the government this week made a decision on the way forward. Our approach continues to be to move forward carefully and steadily with the reopening of our society. Sectors of our society and economy have reopened in recent months and they've stayed open, and we need to ensure that this remains the case. On Tuesday, following public health advice from NPHET, the government agreed that the remaining aspects of hospitality, entertainment and the nighttime economy could reopen. Given the deteriorating trajectory of the disease, this reopening is taking place accompanied by comprehensive protective measures and the wide and robust use of the digital COVID certificate. Our booster vaccine campaign will play a vital role in offering continued support to our most vulnerable. The National Immunisation Advisory Committee, NIAC, has now recommended that a booster dose of Pfizer can be offered to everyone aged 60 and above who's completed their primary course of a COVID-19 vaccine, and my department and the HSE are now implementing these recommendations. NIAC will continue to examine new evidence regarding booster doses for other groups. Personally, I believe there is a strong case for healthcare workers. We are engaging closely and continuously with NIAC on that, and obviously we will be following the evidence and following the science and look forward to NIAC's ongoing deliberations on this. And Ceann Comhairle, can I finish with, I think, another appeal to the hospitality sector. It is essential, if we are going to continue opening up safely, that the COVID pass is used and it is enforced. Now, we all know that the majority of operators in the hospitality sector are doing the right thing. However, an unacceptably high number of them are not. The data we have from enforcement and the survey results we have from patrons going to pubs, going to restaurants, suggest that about 2 in every 3 outlets, 2 in every 3 pubs and restaurants are doing the right thing. They are enforcing the pass, but 1 in every 3 is not. And that has to change. We have to have more compliance. So yes, there are things the state can do, and I'm sure we'll discuss some of that this evening, but it is imperative that the sector itself steps up and ensures that those regulations and that compliance is followed. Good.